CO2. If it's high, which is greater than 45, it's respiratory acidosis. If it's low, less than 35, it's respiratory alkalosis. And then look at your bicarb. If it's low, as in smaller than 22, it's metabolic acidosis. If it's high, which is higher than 26, it's a metabolic alkalosis. Match that system with the pH and check the other system make sure it's compensating, moving opposite to help balance out. Always check oxygenation, your PaO2 and SaO2. A lot of times we're just using PaO2, PaCO2. So these last two, the PaO2 and the SaO2, we don't use a lot, but it can help if you are given that information. All right, so remember Rome, respiratory opposite, metabolic equal. All right, so if these are just some types of imbalances, if we have a low pH, so low, and a high PaCO2, that's an arrow down and an arrow up. That tells me respiratory. So that is respiratory acidosis and is very common in COPD or hypoventilation. Then if we have a high pH and a low PaCO2, again, arrows going different directions. It's going to be respiratory. And again, we'll have to look at our pH. What does it say? It's high. So it's going to be respiratory alkalosis, which is usually hyperventilation, anxiety, panic disorder, stuff like that. If you have a low pH and a low bicarb, you're going to have one, they're the same, arrows going the same direction. So metabolic equal, so metabolic, and the pH is low, so it's acidosis, and that's very common in DKA, diarrhea, renal failure, things like that. And then if you have a high pH, a high bicarb, again, those are equal, the arrows are going the same direction, high and high, then it's metabolic alkalosis. This is very common in vomiting or diuretic use or antacid use. Yes, those times you pop a couple of a day, if you take too many, can cause metabolic alkalosis. Oh, but wait, Miss Debs, what about compensation? Okay, so we've figured out how to interpret our ABGs, but we don't know if the body is doing any good, if the body is doing anything to help this imbalance. So when we're talking about compensation, there's 3 different ways of looking at it. There's either uncompensated, where only one system is abnormal. It's partially compensated, which means both systems are normal, but the pH is still out of range. So meaning the body is working, trying to get that pH back into range using both of the systems available to it, but it is not able to get there yet. So it's still not fully compensated. And then fully compensated when both systems are abnormal, but the pH has returned to normal. Look at which side of normal it leans towards, and that can kind of tell you a little bit more about it. This helps us see if the body is working, if it is doing what it's supposed to be doing, or if we're going to have to intervene. We just want to go through some quick practice examples. I have 3 of them to look at right quick. So on this ABG, you have a pH of 7.3, which is low, right? Because our low is 7.35. So anything under than that is low. So it's telling me acidosis. So I've got that right there because pH tells us if it's acidosis or alkalytic. Then I'm looking at PaCO2, and that PaCO2 is high. Okay, so I've got the pH going down and I got the PaCO2 going up. So that already tells me this is a respiratory situation. But let me make sure that that bicarb is okay. And our bicarb is okay. So we have pH down, PaCO2 up. That's 2 different arrows going the opposite. So respiratory if opposite. So it's respiratory acidosis because the pH is low. Let me see if I got that right. Boom, nailed it. You are going to be able to solve the majority of your ABG problems if you're able to look at it that way. All right, example 2. So when we're looking at that pH, it is high. It's above 7.45, so it is alkalytic. The PaCO2 is low, so that has arrow for the pH going up and arrow for the PaCO2 going down. Those are opposite. It tells me respiratory right there. I already know it's respiratory alkalosis. And that bicarb, or the HCO3, is normal. It tells me that it is respiratory alkalosis. Let's see if we got it right. Boom, crushed it. Done, son. So it told us that respiratory is opposite. So it was respiratory because these two, the pH and the PaCO2, were opposite. And then the HCO3, the bicarb, was normal. So it told me respiratory alkalosis. Perfect. Let's just do one more because I'm having fun. So this one, if we look at it, that pH is low, telling me acidosis. Then that PaCO2 is normal. That's all right, right? All right, let's look at the HCO3. Oh, that's low. So we have low and low, arrows going the same direction. Metabolic if equal, if those arrows are equal, so it tells me metabolic, and then because my pH was low, it's acidosis. Let's see if we were right. Got it. So it is metabolic acidosis. Good job. All right, so the last thing I want you to do ever in nursing is to just look at the numbers and go, huh, well, that's what's going on there. Understand it. So when you see abnormal ABGs, don't just stop at naming the imbalance. Ask what's going on.